Hello and welcome to Auburn Cable TV 20. I'm Dr. Eric Parks and this is Health Matters. I've got a great program today and I have a very special guest. She is a doctor of naturopathic medicine and her name is Dr. Kemby DeLellis, and she's going to be talking a little bit about conception, preconception care, and some other things that she does to help people who have fertility problems. So I'd like to introduce Dr. Kemby. And do you prefer Dr. Kemby or
Yeah, that's
okay?
great. Thanks for having me.
You're welcome. I'm always interested to find a little bit more about a person. So how long have you been doing what you're doing?
Yeah, well, I did my undergraduate at Wake Forest University in North Carolina, so I'm originally from the East Coast.
Right.
And I moved to Auburn about a year and a half ago from Kona, Hawaii, but I've been practicing naturopathic medicine for about 9 years.
Oh, wow. Were you practicing in Kona as well?
Yes.
Fantastic.
Yeah.
So it must have been a pretty good deal to get you to come back to the mainland, huh?
Yep. Yeah, it's a great practice I'm in now here in Auburn.
Oh, yeah.
There's three of us naturopathic doctors and very full practice, so it's a great place.
Yeah, you're very well known. Were you practicing the preconception care in Hawaii as well, or is this a new
It's
endeavor?
developed sort of slowly. So a few years ago, I worked with a midwife and a pediatric specialist, naturopathic doctor in Seattle, and so I really learned a lot more about it there. And I have myself a 4-year-old son, so that's piqued my interest also. So it's kind of developed, my interest in pediatrics and women's health has developed over time.
And I'm sure you're going to inform us a little bit about the statistics right now. I know from personal experience, but also with our own patients, that fertility is becoming a challenge for a lot of people, particularly in this country. So what's been your experience? I mean, I know a little bit about that, but tell us a little more about what the statistics are and all that.
Yeah, the statistics range from about 10 to 15% of couples of childbearing age that have issues or concerns about infertility. And infertility is technically described as a year of trying to conceive without achieving a pregnancy. So there's fertility issues that come about, and with fertility, it's such a big issue, and there are so many different diagnoses that play into it. But there's about 25 to 30% of those that get sort of diagnosed as male infertility issues. Another 25 to 30% that are female infertility issues that can be diagnosed. And then, unfortunately, there's about 40 to 50% that end up in this kind of unexplained infertility where there's no known cause, and that's typically where I see people as the people who fall into that category, because it's so frustrating and it's so confusing to them.
Sure. Well, I would imagine that would be where the interesting part of that is, because coming from non-allopathic means, you're looking at things a little bit different than the male versus the female anatomically deficiencies or what have you. But I'm sure you see some of the others as well. So tell me a little bit about some of the ways that people might have problems with conceiving. Is there a big group of people that have one particular problem, or is there many different reasons?
There are many different reasons. It's pretty complex, multifactorial diagnosis. But usually when you're running through a series of tests, they're looking a lot at a woman's menstrual cycle. So they're looking at, does she have concerns like fibroids, polycystic ovarian syndrome, endometriosis, other things that they know can contribute to infertility. And for men, of course, they look into men's sperm count, they look at motility, and that's kind of where it typically stops for Western medicine diagnosis, and that's not always enough for us. So we look much deeper at some other causes like nutrient deficiencies, deficiencies especially of antioxidants that can play a role, and some women, when they're coming off of oral contraceptive birth control pills, can have a really hard time balancing their hormones after that.
Right.
So they can have trouble conceiving, even if their body was kind of functioning normally before and they don't have any health concerns. So, yeah.
Well, one of the themes of the guests that I have on the show is that we all believe that there is some innate intelligence that guides the body's functioning, not only from birth to growth, but also to repair and maintenance. And we also believe that in an attempt to preserve not only us, but our future generations, the body will do what it needs to do to defend itself, or in some cases, to not reproduce if there's a problem. So I'm sure that's one of the things that you find is that if there are fibroids, or if there is hormonal imbalances, or we might get into toxicity here, those are going to be some of the areas that you'll help people with. And so how would we go about, let's say I and my wife are here and we're discussing fertility issues, and we tell you the same thing. Oh gosh, we've been through this, sperm count's fine, her cycle's been fine, we don't find any other problems, we just can't conceive. Where do we go now? What do we do?
Yeah, so it's, part of the beauty of naturopathic medicine is that every client or every patient that comes in is very different. So, that's why we take such a thorough history and go through, a lot more information about diet and sleep and so on, so that we really get an idea of what are those factors that are that could be contributing. But that's a lot of what we talk about is just, do you have any of those lifestyle things? Do you have a high stress job? Do you potentially have a high toxin load in your job or in your life? Do you, how's your sleep? We look at all those things and kind of try and determine what other things, like are stress hormones high or low, is obesity a concern? And there are things, or cigarette smoking, for instance, some simple lifestyle things that we could talk about that that can hurt your chances of conceiving. And then the typical workup, if a couple comes in and they've already kind of had the standard workup, then I can go from there. And our hormone testing tends to be a little bit different. We do saliva hormone testing in the office. So, serum hormones that they test is just a snapshot right then and there of what's in the bloodstream. Usually they just run an estrogen, sometimes a progesterone. So we can do several different kinds of estrogens. We do progesterone. We can look at the ratio of one hormone to another. So, and with the saliva, it's the free or the unbound hormone, and it's a more averaged. So we get a much more comprehensive picture of what is their hormone cycle like, and is that contributing, and how do we optimize that, really? So not just, can I check off that there's no disease process here, or there's no glaring deficiency, but really look at is there a way we can optimize this to really improve chances of pregnancy?
Right. So you're not necessarily looking at this as from the standpoint of what hormones do we give you to balance this out, but what might be out of balance in the body causing a hormone problem. And you mentioned nutrition testing a while ago, and I know some of that can play a big role in hormone balance in the body.
Absolutely.
Tell us a little bit about the nutrition test that you do.
So we do a test called the micronutrient panel, which looks at, within the blood cells themselves, looks at levels of B vitamins, antioxidants, amino acids, and fatty acids. So it kind of looks at what you're getting through your diet, what you're getting through your supplements that you're taking. And we know that people have genetic variations in how much of a particular vitamin they need. So it helps us to really, again, tailor it to the individual, because we know, for instance, if someone's low in vitamin E, it impacts their fertility. For men, it's mostly antioxidants like zinc and selenium that can affect their fertility or their sperm count. So, if we were to just not test, I'd be giving someone buckets of supplements, but this gives me a way to say, well, here's the known factors that can affect your fertility, and for you personally, or for you as a couple, these are the ones I want you to take, because we need to optimize your levels and bring you into range. So it's very helpful, and people appreciate it, because it really gives them a sense that what they're taking is for a reason, and and it's tailored to them, so they feel like they're doing something that's meaningful.
That must be a great relief to people that have been out there getting all these blood tests coming back with shoulder shrugs, and now you're able to
Yeah.
look at some things that are impacting them on a daily basis. And you mentioned earlier stress. Well, gosh,
Hmm.
about everything that we see wrong with people has to do with stress, whether it's emotional stress or chemical stress or even physical stress.
Hmm.
And so looking at the nutrients sounds like a really good way of looking at that chemistry in the body to
Yeah.
see what might be throwing things off. What do
Hmm.
you do about the emotional stresses? I hear that's really big, and that 40 to
It is.
50% people, they just don't know what's going on. And
Yeah,
you know,
anytime a couple's, wanting to conceive and they're having a hard time conceiving, it's a really emotionally difficult time. It can be really draining, really difficult. And generally, they're also trying to, hold down a job. Maybe they already have some children or a child at home, because we see secondary infertility as well. And so they're they're having this kind of additional stress on top of whatever their lifetime stress is. But sometimes for people it's just having them alter their work schedule, or maybe they've been working nights, and that can certainly impact their hormone levels. We know chronic stress can shut down the endocrine system, can decrease your hormones, which is never a good thing for fertility. So
right.
so a lot of times it's just asking those questions of, what do you do to manage your stress, and how do you relax yourself, and how do you unwind, and what things can you do now to sort of manage this additional stress of, especially if they're going to be doing IVF or other kinds of fertility
Right.
treatments.
Right. Yeah, we've all heard the stories. I'm sure you get it too. My brother and I both had the same issue. We tried for 10 years each.
Hmm.
No children. We just decided, okay, well, I guess we're not having children. We adopted. He adopted. Within 2 years, both of us had a child. I mean, our wives had children on the way.
Hmm. Hmm.
How do you explain that? Well, I'm sure that there was some psychological or some stressors there
Yeah.
saying, well, we got to keep trying, got to keep trying. Once you stop trying, your hormone levels get back into balance because you're not stressed about one more thing.
Yep. Yep.
So
You do. You
that's a
see
big
that. You see that all the time, and it's difficult to tell someone not to be stressed about it, but you try. One thing I do, because it's difficult to even track your basal body temperature and do the charting. There's a lot that can go into, a couple understanding when their fertile period is, and and all of that. It can take. It can be kind of draining. So sometimes, it's just as simple as taking a break, taking, a month or two off
Right.
at a time, and kind of reassessing, and just taking that mental or emotional break.
Sure.
Yeah.
Well, you mentioned earlier something that I wanted to touch on, or I wanted you to develop a little bit more. Toxins. This is something that we all talk about. I think I've had several guests on who put people through detoxification programs.
Yeah.
So how do you look for toxicity, or when do you suspect that that might be part of a couple's problem?
Sometimes, we didn't talk a lot about preconception, but often I'm doing that if I have that time before a couple wants to get pregnant, where we'll talk about doing a 2-week detox or a longer detox to just prepare their body and get rid of some of those toxins before baby comes on board. But there's some conflicting research out there about our infertility levels rising, but one of the sort of factors involved are just the levels of pesticides and toxins in our environment, and many of those, so we get them from the air that we breathe, so pollution, pesticide residue, plastics, so things like phthalates, BPA, and they're in our water supply. There's also possibly some estrogen from oral contraceptives getting into the water supply, so that affects hormones. So both men and women's hormone levels are affected by those things, because many of those are what's known as endocrine disruptors or hormone disruptors. And so what they do, especially over chronic exposure, is they can reduce sperm count in men. They can cause estrogen dominance, typically in women, so they mimic your body's own estrogen, and they can kind of wreak havoc with the system. So a lot of times, I mean, definitely part of the fertility diet is talking about eating organic when possible, you know, grass-fed and wild-caught meats, and fish, and you know, decreasing the toxic load in what we eat. And also, when we can, talking about environmental exposures from things like skincare products that, you know, can have phthalates in them, and
Yes.
and other hormone disruptors and makeups and things. So those are easy things to cut out, and, you know, just go with the more natural products, sunscreens, all those kinds of things can definitely play into it.
I would imagine you have a handout that says, hey, these are the things you want to avoid. Eat these types of foods. That would seem normal.
Yep. Yeah, talking about less toxic lifestyle, and I mean that's definitely part of most visits, is having that discussion, because it impacts much more than fertility. It impacts most chronic illnesses, as you know. So
absolutely.
So yeah, but you know, the reason I love working with fertility in general is that, you know, you're really impacting the next generation before they're even conceived or before they're born. So when you can decrease their level of toxicity that they're entering the world with, you can, you know, potentially decrease their risk, or theoretically decrease their risk of all these chronic diseases that are a result of toxin load. So that's part of my passion for it.
Oh, sure.
Yeah.
Now, we had a guest on, we were talking about autism is affecting now 1 out of 88 kids, and that's just unacceptable.
Yeah.
And I'm sure that has its roots back there in the preconception care,
Absolutely.
toxic load by the parents, and of course the way the child is raised.
Yeah, there was a recent study about moms' T4 levels, so thyroid hormone levels, and if they're low before she conceives and an early pregnancy, often before we're even testing women, you know, testing their blood when they become pregnant, if her levels are low, her child's risk of autism is higher, you know, by quite a bit. So it's, you know, it's again that importance of preconception and getting some of those levels tested before, you know, if a couple's thinking of conceiving or wanting to start a family. It's very important, and it's important for the, you know, not only their health to get things really optimized, but preventing illness in their children, which is quite amazing.
Boy, I can't imagine why anybody would not want to come to you who is looking to have children, because gosh, how would you know going in? Do I have a level of toxicity? How about heavy metals? I mean, all these things that you can look at for them, and take them by the hand and say, here's the things you can optimize your, not only your health, but the child's health and your chances of conceiving. It just makes so much sense.
Yeah.
Gosh, I applaud you for your efforts.
Thank you.
I'm a little bit, I want to go back a little bit. You were talking about preconception care. What are some of the typical things that you find with, what do you have to do to help people?
Well, one of the things is definitely doing basic blood work. Sometimes, you know, in young people, they've never had things checked, like their vitamin D. They don't, you know what their red blood cell counts are. Right. So they could be slightly anemic going into pregnancy. They could possibly have a low thyroid condition. So those things can impact their fertility or their ability to carry a pregnancy. But also, it's just about optimizing their health so they have more energy to sustain the pregnancy and, you know, early parenthood, which is challenging enough in its own respect. So that's one thing that we do, is just basic blood work. We also just kind of talk about preparing physically and emotionally, you know, for the big lifestyle change that's going to happen. We definitely do on most couples the micronutrient panel, again, to just get a baseline there for how their nutrition is. And, you know, a lot of it's just talking about dietary factors, lifestyle factors, like smoking and decreasing caffeine and those basic things. And, you know, also talking about optimum weight. So that's kind of a bigger concern coming up in women who are wanting to conceive. If they're overweight or underweight, both of those can raise their infertility rates by quite a bit. So even dropping, you know, 5-10 pounds in the 6 months or a year before they're wanting to have a child can not only lower their toxicity, but improve their ability to conceive in a shorter time.
Is there some connection, and I haven't read this, but is there some connection between insulin dysregulation and ability to conceive?
Yes, very much so. So PCOS is often where that's found. That's it's called polycystic ovarian syndrome, and that is sort of a metabolic syndrome. So some insulin resistance. Sometimes women are overweight and it also is a hormone dysregulation where they're producing more androgens or more testosterone than estrogen. So it's kind of a multi-layered condition, but insulin resistance by itself, absolutely. And a lot of times, even celiac disease or food sensitivities that trigger the immune system can impact fertility. So a lot of times we're working on digestion, we're changing the diet to be maybe more of a paleo diet or a low refined sugar, low carb or low flour diet, and those kind of things really can make a big impact.
I'm glad you brought up the diet aspects of that because the gut dysbiosis, as you were saying, that's when the gut bacteria get imbalanced, inflammation occurs. Inflammation then causes things like arthritis, but can also, as you were saying, cause the inability to conceive. I could even imagine an autoimmune type reaction going on with that.
Yeah.
So huge to be able to identify that. And a lot of people, I know they accept, oh, I have Crohn's disease or I have IBS, and they could just take medication for that. But if they're trying to conceive, I could see that being a real block to that.
Yep, it is. And so there's a lot of, healing the gut, and that also helps them absorb their nutrients better. So they may have a great diet, it may be very clean, but it's not working for them because either they're eating something that they're chronically sensitive to, that's, impairing their gut lining and their absorption, and then they may not have an optimal vitamin D or a vitamin A or a vitamin E, and those are really important for fertility. So, so it's getting to that root and figuring out, why, what's happening in the body, and how do we really help? I mean, it's always about achieving optimum health, whatever condition we're working on or whatever age group we're talking about. But with this, it's really helping mom and potentially babies.
Right. So like the nutrient testing that can specifically identify imbalances, you can also do tests for gut dysbiosis and find out if there are possible allergies, parasites,
yes,
imbalances in gut flora, those
leaky
kind of
gut,
things.
or
So
there are, mostly again blood tests that we do, but there's one test we run very often that looks at 150 foods, so a big amount of foods that they're eating, and how much is the immune system reacting to them. So it's kind of tailoring a diet for them to just calm their immune system down, calm any inflammation down, because sometimes just unexplained inflammation, it's often gut related, and it's one of those things that fits into that unexplained infertility. If other things are normal and there's still something standing in the way, then we'll look at that.
Right. I'm familiar with that test, and I run that as well. I find that there's a lot of people surprised that things that they're eating every day are causing their gut to be inflamed, and sometimes it's as simple as avoiding that food for a few months and letting that normalize.
Yes, absolutely.
Okay, so let's say we are successful. My wife and I have come in, we've talked to you, the preconception worked, we're eating better, we've figured out that there was some genetic issues, but we've overcome those genetic potential things. And now, what do? Do we continue to check in with you to see how things are going, to make sure the pregnancy is happening? Is that something that you offer?
Yeah, so a lot of times, I follow along with the obstetrician or the midwife. I follow at least through that first trimester just to, help them maintain the pregnancy. Often we're, again, testing nutrient deficiencies because, mom especially needs more in that time frame. So we want to make sure she's, getting enough of those nutrients for both her and baby. Otherwise, baby will take it all. So, yeah, and then, oftentimes some of the testing that we do and some of the work that we do isn't done, in sort of a conventional medical office.
Right.
So a lot of times they're following me kind of just for those specialized things through birth, and then generally I see baby 3 months later.
Right. I always like to say, the physician's going to look for anything that's wrong. People in the healthcare business, the true healthcare, I say we look for what's not quite right, and that way and there's a big difference.
Yes.
So you can help guide them. I think that's real important. Well, all of us have some great stories about some successes that we've had, and I'm sure you have a couple that you'd like to relate. So tell us a little bit about some
Mm-hmm.
who've had particular problems that you've helped them with? Don't mention names.
Yeah, no. I was just thinking about when I first sort of segued into and got more interested in fertility. It was because I was at that time of life myself, and some of my good friends were going through it as well. And I remember just sitting down and talking to one of my good friends about just the process. When is your most fertile time of the month, and what are ways that you can optimize your success, and when is that window, and how do you find it, and how do you know the signs yourself in your own body. And I remember at the end of it, she said, I've seen so many fertility specialists, I've seen my gynecologist, and no one's ever given me just this basic information of how. And she conceived a few months later, but it was just setting her expectations and helping her to really understand just the basics of what happens,
Right.
what happens, and how to be prepared, and how to really have every month be a trial and be a success. But a lot of times people think, oh, I've been trying for 3 months and I haven't gotten pregnant, so now I'm concerned. And so just resetting their expectations
stress
for
levels go up,
well,
yeah.
it's really more like a 40% chance, or it's really with where you are, it's really more like a 20% chance based on your age. They're like, okay, so maybe something's not wrong, and I can relax a little bit. So a lot of times, that's really the rewarding part, is when I'm able to educate and see the light bulbs turn on in people's minds of, okay,
Right.
this is doable, and this is, you can kind of give them that encouragement and that support.
Oh, great.
Yeah.
Yeah, we don't learn that in school. It's not something we learn. And the word doctor means teacher. So I can see that this should be something that everybody who is embarking on this might want to consider, to come in, check in, say, yeah, we don't know if we have any problems or not, but gosh, we want to make sure that we're healthy, that our baby's as healthy as can be. 1 out of 88 kids having autism. This is not good statistics, and we want to optimize. This, I would wholeheartedly expect people to consider that as, a primary concern. I don't think that they should not see a physician as well, but they certainly could gain a lot from your knowledge and your expertise in these tests that typical physicians are not going to run.
Yeah, and especially, depending on the age, people are starting to decide to have a family older and older. So in their,
Yes.
Early 30s, late 30s, and they may not have the length of time. So to go a whole year before being able to seek, fertility management or specialists can be difficult. So, a lot of times I'll see people that are just, we know we're ready now. It's a little bit later, and how can I give myself the best chances. So, so yeah, it's fun for me to be able to do it and do the education. And when I think about my love for pediatrics, is really getting kids at such a young age healthy, so they have their whole life. And with this, I can help before a baby's even conceived, or before a baby's even born, improve their health for their entire life. So it's very rewarding.
Well, if our astute audience wants to get in touch with you, how would they get in touch with you? Do you have a website?
We do. It's long. It's www.auburnnaturopathicmedicine.com. Or our phone number as well is 530-885-5908.
Great.
Our front desk would love to hear from any of you.
Well, I appreciate your work. I'm so happy that you were able to share with us today, and there's so much more I know that we could talk about, but we'll have to leave that for another time. Thank you again, Dr. Kemby, and thank you for watching ACTV 20. Your website? Did I get the website on?